Glenmax Peb Dm is a combination medication used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. It contains dextromethorphan, which is a cough suppressant that reduces the urge to cough, and decongestants to relieve stuffy nose symptoms. It also includes antihistamines to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years, so do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Additionally, some forms of this medication are not recommended for use in children younger than 12 years. It's essential to carefully follow all dosage directions to decrease the risk of serious side effects. Do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients without consulting a doctor or pharmacist. It's always best to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or using saline nose drops or spray. When taking Glenmax Peb Dm, be sure to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. You can take this medication with or without food, and it's best to wash it down with a full glass of water, 8 ounces or 240 milliliters. If you experience any stomach upset, you can also take it with food or milk. If you are using the liquid form, be sure to measure the prescribed dose carefully with a medication measuring device. Do not use a household spoon. If the liquid form is a suspension, make sure to shake the bottle well before each dose. For the extended release capsules, swallow them whole and do not crush or chew them. The same goes for the tablets unless they have a score line and your doctor or pharmacist tells you to split them. Chewable forms should be chewed thoroughly before swallowing. If you are taking the powder form, mix it thoroughly in the proper amount of liquid and drink all of the liquid right away. Do not prepare a supply for future use. The dosage of Glenmax Peb Dm is based on your age, medical condition, and response to therapy. If you are taking this medication for allergy or hay fever symptoms, take it regularly to get the most benefit from it. It's important not to misuse this medication, as it can result in serious harm such as brain damage, seizure, or death. Do not increase your dose, take it more often, or use it for a longer time than directed. If your condition lasts or worsens, be sure to inform your doctor. Some common side effects of Glenmax Peb Dm include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless, hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's also important to drink plenty of fluids to prevent the medication from drying up and thickening mucus in your lungs, which can make it more difficult to breathe and clear your lungs. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. If your doctor has prescribed this medication, they have determined that the benefit to you is greater than the risk of side effects. Serious side effects are rare, but it's important to contact your doctor immediately if you experience any mental/mood changes, ringing in the ears, shaking, tremors, trouble urinating, weakness, easy bruising/bleeding, fast/slow/irregular heartbeat, or seizures. In the case of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before taking Glenmax Peb Dm, it's important to let your doctor know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to inform your doctor about your medical history, especially if you have any breathing problems, diabetes, eye problems, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems. Glenmax Peb Dm may make you feel dizzy or drowsy, or blur your vision. It's important to avoid alcohol or marijuana, as they can increase these effects. It's also important to be cautious when driving, using machinery, or doing anything that requires alertness or clear vision. If you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist regarding the safe use of this medicine. If you are diabetic, have alcohol dependence, or liver disease, you should use caution with the liquid preparations of this product as they may contain sugar and/or alcohol. It's important to talk to your doctor or pharmacist about the safe use of this product. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness, drowsiness, mental/mood changes, constipation, fast heartbeat, trouble urinating, or blood pressure changes. Dizziness, drowsiness, and confusion can increase the risk of falling. In children, especially young children, this medication may cause agitation/excitement instead of drowsiness. It's important to use this medication during pregnancy only when clearly needed and to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. When taking Glenmax Peb Dm, it's important to be aware of potential drug interactions. Avoid taking MAO inhibitors with this medication, as it can cause serious and possibly fatal interactions. It's also important to be cautious with other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, or drugs for sleep or anxiety. Make sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Additionally, this medication may interfere with certain medical tests, so be sure to inform all medical personnel that you are taking Glenmax Peb Dm. If you or someone else has taken too much Glenmax Peb Dm and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include agitation, confusion, flushing, hallucinations, dilated pupils, muscle twitching, and seizures. In children, excitement may occur initially, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. It's important to seek medical help immediately in cases of overdose. If your doctor has prescribed Glenmax Peb Dm, do not share it with others. Make sure to keep all medical and lab appointments. This medication is used to treat symptoms such as cough and chest congestion caused by the common cold, flu, or other breathing illnesses. It contains guaifenesin, an expectorant that helps thin and loosen mucus in the lungs, making it easier to cough up the mucus. This medication also contains dextromethorphan, a cough suppressant that affects a certain part of the brain, reducing the urge to cough. The recommended dosage for adults and children 12 years and older is 10 ml every 4 hours, not to exceed 6 doses in 24 hours. It is best to take Glenmax Peb Dm with food or milk to prevent stomach upset. If you are taking Glenmax Peb Dm on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. As for the optimal timing, it is best to take Glenmax Peb Dm as per the dosage instructions provided by your healthcare professional. Make sure to store Glenmax Peb Dm at room temperature and away from light and moisture. It's important not to store it in the bathroom and to avoid freezing the liquid form of this medication. Keep all medications out of reach of children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. When Glenmax Peb Dm expires or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.